Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. We have a lot to talk about, and I wanted to start with just a general update on how the vaccination process has been going thus far.
I think it has been going quite well. We have started in all the regions yesterday. We have teams that are deployed in different parts of the country, and the response has been good. As we get those numbers and we compile them, I'll be able to give you the numbers of how many persons have been vaccinated. But so far, it has been, yesterday was a good day, and we expect as we go through this immunization program that we'll get more people coming out, more people would know where the sites are and so forth. And we'll get more people vaccinated in a shorter period of time.
Okay, sir. I got some questions from Prime News and Stabrook News today, and Prime News is asking how does the ministry plan to address cases where health workers are refusing to take the vaccine?
Well, health workers have an option. They can either take the vaccine, or if they don't want to take it, that's okay too. But our job as a ministry and as a government is to be able to offer them the vaccine, and it's their choice whether they like to have the vaccine or not. You would recall that the President has said that we are not making this mandatory, but I'm very sure that health workers, nurses, doctors, other people in the health sector, they understand that because they are more at risk because of their interaction, that it would be wiser to take the vaccine because it's protective. It would help to reduce infection, and of course, it prevents the most severe and critical forms of the disease. So if you are immunized, then you are protected, and I'm sure that health workers want to be protected. I think maybe initially there was some skepticism, but I think that is changing because initially people were worried about maybe the side effects and so forth. But a lot of people have taken the vaccines so far, and they have had very mixed side effects. Most of those are things that you would expect with any injection. At the site of the injection, there's a little bit of pain. Some people might experience a little bit of fever and so forth. But these are all things that you get with any injection. So I guess now that people are becoming more familiar with some of the side effects, they would now start considering seriously about getting their vaccines.
All right, just a follow-up to that same question. So no one will lose their job if they don't take the vaccine. That is something that people are speculating about.
How is that even a consideration?
Yes, sir.
Again, the vaccine is purely voluntarily. You take it if you want to take it. We would, of course, encourage you to get it because we know that it works and it's protective. And around the world, people are really trying to get access to vaccines. So we are very privileged to be able to get access. And even here at home, here in Guyana, a lot of people have been calling and they want to get the vaccine, right? We have restricted it so far to healthcare workers and to older people. But there are other people who want to have the vaccines. So my thing, and I've been repeating this over and over, if you get a chance to get your vaccine, take it, right? Because other than that, the next round, other people would be eligible. And those people really want to have their vaccines. So please take it.
Yes, sir.
Nobody's going to lose their job if they don't take it, but yeah.
Yes. Thank you, sir. A follow-up question we had. So now that we've noted that members of the joint services are there to get the vaccine as well, and Prime News just wanted to know what other category would follow that.
So right now, with the 50,000 doses that we have on, the 100,000 doses that we have on hand, which is for 50,000 people, our priority list right now is for us to give to healthcare workers, both in the public and private sector, and older people, people 60 years and above. After we completed this, we'll then, and we get more vaccines in, then we'll go to other categories of persons. But right now, our focus is on healthcare workers and, of course, the older people. And the reason being is that when we look at the, the people who have died during COVID, we find that people aged 60 and above, a lot of the persons who have died fall into that category. And globally, we have seen similar trends that older people are more vulnerable to the more severe and critical form of the disease. So if we are able to immunize those persons, then we protect them from dying from COVID. And that's why we have this effort of trying to immunize older people first. And of course, our healthcare workers who are constantly exposed, we want to protect them as well. So these two categories are right now our priority category. And once we would have completed them, then we go on to other groups.
All right, and last week when we spoke, you would have indicated how you were going about that. You were working with the Ministry of Social Protection and so on. I just thought that we should remind people of that. Let me just go to a question.
But even that, once people know that they're over 60 and above, they can come to one of the immunization sites. We are using a lot of our health centers. We have on a rotation basis where we'll be going. So once they know that we are in a community, they bring their ID card and come. And once we can verify that their age is 60 and above, we'll be able to give them the vaccines.
Okay, great. Thank you, Minister. Starbrook News now, they're asking, with the 100,000 doses of vaccines that we have now, both the Sinopharm and AstraZeneca, will there be a rollout concurrently, or will the ministry seek to roll out them as how they were received? Sinopharm first?
No, we have actually distributed across the region, and they're being given at the same time.
Okay. And they're also asking, what are the current treatment protocols used in the country for COVID-19 patients? In this case, what drugs are being used to treat those COVID-19 patients that are hospitalized with this severe form of the disease?
Well, that's actually a more complicated question because we do have a clinical committee dealing with COVID-19, and they have come up with guidelines. And in fact, today we are meeting with the regional health officers, and they'll be going through a training because we have developed clinical treatment guidelines for COVID-19. And we are now using those guidelines to train the RHOs and others so that they can roll that out in the region. So these are clinical guidelines for 2021. And as you can imagine, things are changing rapidly. So as the changes happen, we are updating these guidelines. But broadly, the disease, we can look at it in two broad ways. At the beginning of the disease, it's really the virus trying to replicate and get a stronger hold in the body. And therefore, there are a set of medications that can be used to reduce replication. And then later on, if somebody end up with the more severe or critical forms of COVID, a lot of times that happens because the body's immune system has an exaggerated response, something that is often referred to as a cytokine storm. And therefore, at that point in time, you need to use a different set of medication to handle that. This disease also, we know that it can affect many organs of the body. So it can affect your heart, it can affect your GI tract, it can affect your brain. So there are different manifestations. Different patients would present with a different set of symptoms, and depending on what we're seeing in that particular patient, we'll have to alter the treatment to suit the particular patient. So no one patient would have one set of symptoms. They all vary, right? And depending on what we are seeing in that specific patient, that's how we'll have to adjust our treatment. In addition to that, because many of these patients that ended up in the ICU are older and they have comorbidities, that then also complicates how we treat. So to really go through all the details of how we treat and what we use and so forth, it's going to take a long time. And but just to say that today we are launching the new guidelines for 2021, and we have had an expert group, local physicians, along with international organizations that have helped us to put together these guidelines. And so those would be launched today, and I'm sure a copy can be made available to you so that you can see the details of how we treat the patients that are coming in.
All right, thank you, sir. My last question from Stabrook News, they're asking are there any other bilateral deals Guyana is working on to get more vaccines, and if so, how are those coming along?
We have several discussions that are ongoing. However, those discussions are still developing, and as we get closer to fruition, we'll be able to make those arrangements known. Several bilaterals and several discussions with the manufacturers of the vaccines as well have been ongoing, and we are hopeful that during this month we'll be able to bring some of those to conclusion.
All right, Minister, thank you so much for speaking with us today.
Thank you for having me.
Yes, sir. Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.